Communication with patients is an essential part of medicine. Without communication, doctors couldn't diagnose illnesses or injuries. That's why I'm here to give you 7 tips and tricks on how to achieve better patient communication in the clinic. My first tip is to have a conversational tone with your patient. This is because if the patient does not feel comfortable telling you information, they often can't give you an accurate picture of the illness or injury. If you don't have an accurate picture of the illness or injury, you can't make an accurate diagnosis. This is why it's important to keep a conversational tone with the patient to achieve better patient care. My second tip goes along with my first. You need to be open and personable with your patient so they can relate to you. If they can't relate to you, you can't get anywhere with communication, because if the patient feels apprehensive to tell you information, you won't get anywhere in your diagnosis. One of the most important things a doctor can remember is to not make the patient feel shameful for not adhering to treatment. This is because if, per se, a patient doesn't follow a treatment plan that you prescribe, you need to be open and honest with them about why it didn't work and how you can make it better. If you make them feel shameful, they'll close down and not want to talk to you about their illness or injury, making them more susceptible to illnesses and injuries that you could have treated. This is why it's important to talk to them with respect and kindness when talking to them about their treatments. My fourth tip is something that all doctors need to be prepared for. Emergency situations. They're inevitably going to happen. You need to react with calmness and empathy for the patient, because if you react with cruelness or urgency, the patient will have those same feelings. That's why it's important to react with calmness and empathy towards the patient situation. My fifth tip is for when you have visits with children and parents. You need to both pay attention to the patient and the mother or father. This is because if you don't pay attention to the child, they won't tell you crucial symptoms that they're having that can give you a more accurate diagnosis. On the other hand, if you ignore the parents' requests for information, they might get mad with you and not want to visit you in the future with their children. That's why it's important to address the concerns and fears of both the child and the parent in those situations. My sixth tip is for when you are prescribing medications or treatment plans. You need to make sure that you have the patient's preferences in mind. How much can they afford? Is this medication the right treatment for them in their current situation? These are all questions that you need to ask yourself before you prescribe a medication. Because if the patient, say, can't afford a medication, you need to make sure that you change that treatment plan so they can. Because if a family can't afford a medication, they simply just won't take it. My last tip is to make sure that when you prescribe medications or treatment plans, you make them easily adherable. This is because if the patient can't easily adhere to that treatment plan, they simply won't want to follow it because it's too complicated or takes too much time. This is why it's important to always have the factor of adherence in mind when prescribing medications or treatment plans. The goal of a doctor is to treat the patient the best they can. That's why I gave you 7 tips and tricks to achieve better patient care and patient communication. Thank you.